Hey everybody, I'm Abdullah Anani and you're watching Hot TMM. It's the show with hot questions and even hotter wings. And in the studio today we have our two experts on Zolgensma, Ali Howe and Peter Hahn, who are going to tell us all about the new drug. So Zolgensma is a drug used to treat spinal muscular atrophy or SMA, a rare genetic disease that affects about 1 in every 10,000 babies. It causes progressive muscle weakness and wasting, and although rare, it is the leading genetic cause of death in infants. Spinal muscular atrophy is caused by a point mutation or deletion in the SMN1 gene, and although the backup SMN2 gene is still present, it alone cannot produce enough SMN protein. This leads to motor neurons that are unable to function properly, which leads to a chronic decline in movement, breathing, and other bodily functions. So as you guys know, until recently, Zolgensma didn't really have a promising cure, but we've seen promising results, and I think we're all excited.
Absolutely, yeah, us as well.
All right, I don't want to hold you guys any further, so without further ado,
Let's do it. I'm excited.
First wing.
all right, guys, sweet and simple. Let's just roll into the history of it. Do you want to tell us about that?
Yeah, of course. I love history. So it all started in the 1960s, where scientists discovered the first adeno-associated viruses and thought maybe we could use these as like a safe transport method for certain drugs. And so in the 90s, then we discovered a variant called AAV2, and it was the first time that this was used to treat people with cystic fibrosis, and it showed that it worked. So for us, 2009 was a big turning point because this was the first time that we used AAV9, which we found could cross the blood-brain barrier and enter motor neurons. And this is exactly what we needed to treat people with spinal muscular atrophy.
Exactly, and from that point, we then removed all pathogenic parts of that virus, so safe to use and it wouldn't replicate inside humans. And we then inserted SMN1, the gene, into said vehicle, and it was safely delivered into humans, and we've helped so many people since then, and now, kind of closer to now, 2019 is when we received our FDA approval.
I think this one's gonna be pretty hot. Looks pretty hot.
Do you guys want to tell me a bit about the drug Zolgensma? Personally, I'm a poli-sci major from Carleton, so
Just like how it works and stuff.
Exactly, yeah.
I want you to know I'm a GG. I don't think we're gonna be friends.
I don't think so either.
Okay, sounds good. So,
Zolgensma, as we talked about, uses the vector AAV9. So what we've done is we've removed all the virus's DNA and added a good copy of the SMN gene. And this AAV9 vector can then cross the blood-brain barrier, which is a big struggle with a lot of other drugs. We use that as a vehicle to carry functional SMN1 genes, which is a self-complementary gene copy of the human SMN1 protein with a cytomegalovirus enhancer. I'm going to let my colleague explain what that is.
Yeah, so the CMV enhancer is sort of like a light switch that is always on, which means that there's like constant production of the SMN protein. And then this injected DNA exists as an episome, which is a circular piece of DNA outside of the genome. And this allows us to restore like the normal amount of SMN1 protein levels, which allows for normal motor neuron development in infants. And the unique thing about Zolgensma is that it consists of a single injection, a one-time treatment for revolutionary change in SMA1 patients.
Wow, that sounds really interesting. I mean, the concept sounds really simple, but I'm sure a lot of trial and error did go into it. Do you want to tell us a bit about the clinical trials, maybe?
Oh my god, really burned.
Yeah, sure. Like the first major trial was in 2014 and lasted till 2017, and it was called the START trial. And here it was the first time we gave babies with SMA an intravenous dose of Zolgensma, and every single baby that we gave this dose in START trial lived past 2 years old, which was very rare to see before this drug.
I don't know how you're still standing. Like it's really hot. Okay, so next phase, 2017 and 2019, we carried on with the clinical trials, but on a larger multi-center basis, and we just proved on a larger scale that it can do the exact same thing we saw in the START trial. We can hit those milestones, and it's safe to use.
Yeah, and now we're in the sprint phase, and so here we're trying to treat babies that are not symptomatic yet, but have the gene with the drug, and it's been really, really good so far.
It's just a waiting game, we'll find out. Well, you know what, guys? I saved the hottest tweet for last, so good luck. But you know what? With every drug, there have to be some downsides. No drug is perfect, so do you guys want to tell us about the improvements you're making to Zolgensma?
Yeah, of course. A big thing is liver toxicity, and we're working hard to improve the selectivity for just neurons to reduce the load on the liver.
I think one of the other things we can talk about, sorry, it's really getting to me now.
Okay.
Antibodies immunity. If the infant already has these antibodies for AAV9, then we can't go ahead and administer because the immune system will attack the treatment. That's something we're looking to tackle, and hopefully we can do that.
And timing is really important. We know it works best if it's given before 2 years of age, but early screening methods aren't that great right now, so we're also trying to improve that.
Absolutely, and as you all know, Zolgensma is one of the world's most expensive drugs at the moment, at $2.3 million at the price tag. It's not accessible for a lot of families, so that's something we're definitely working on. Hopefully getting that price tag down.
making it more accessible.
And let's hope we can save more lives in the future. But you know what, guys? Nothing is perfect in life except for this Hot TMM episode. And you know what? I just want to say thank you so much for coming on the show today. We had a great time. We talked about such an important cause. And I'll drop the floor to you.
Thank you so much for
Thank
having
you.
us. We're
Thank you very
really
much.
happy to be here talking
Thank
about
you,
this.
guys. Appreciate it.
Great
I'm gonna
wings.
take that water now.
Yeah.
2, 1.
Hot TMM!